Magandang araw sa kanilang lahat. Welcome aboard to my YouTube channel. Eto na naman ang viral issues na dapat nating malaman lahat. Governor GWEN Garcia nagsalita na naman regarding sa mga fake headlines ng DOH na may third wave ang Cebu. Na pati ang mga ibang sakit sinsama nila sa cases kuno ng COVID. Ang ginagawa ng DOH sa COVID cases ay double-digit ang pagbibilang. Obviously mga hospitals are involved in this. They are the ones who are reporting to the DOH. Ano sa palagay niyo mga kababayan? Mag-comment lang kayo kung ano ang inyong opinion sa mga agenda ng DOH. Panuorin pagpapaliwanag ni Governor GWEN Garcia sa mga sinabi ng DOH.
But what figures are we talking about? If we were to compare it like for example, a place that has, shall we say, COVID cases of 2, and then the following day, there are 2 more. So that's double digit, is that? It's an increase of practically 100%. So let's have a sense of scale. We shall be speaking in English so that I shall be understood by all that are watching me this afternoon. I have decided to come on live again after quite some time because I need to speak up for Cebu. For the past few days, our local papers as well as national papers have been blazing with headlines claiming, like for example, in the Freeman, the third wave in Region 7. And then today, because of course it's always a competition between these two local papers, not to be outdone, Sunstar comes up with double-digit COVID case hikes in Cebu. Now, what is really happening? It is easy to make shocking headlines. These are just words that are printed after all. But it's another thing when we give context, scale, and proportion to these claims. That is when certain claims that what I might call irresponsible journalism will fall flat in light of figures that we present and in light of the scale and context that we will present. And so, what is really happening in Cebu as well as the region? Let me start with a report on the actual situation in the province of Cebu. As of July 11, our total active cases stand at 690. This may differ from the claim of the DOH because you see their data is often late and often unvalidated. But these are all, every number that I present are all verified, confirmed, and validated. So of the total cases from April 20, 2020 until July 11, 2021, because this is the only disease, I don't know what is so special about this, that we have kept a cumulative total. For all other diseases, we reset. We get the numbers for 2020 insofar as tuberculosis cases are concerned, and then we differentiate that from 2021. But no, not for COVID. We must get this cumulative total. For whatever reason, I cannot fathom. But here it is. Total cases from April 20, 2020 until July 11, 2021 is 17,447 total cases. These numbers are all verified. Of the 17,447, there are recoveries, there are deaths, and so our active cases are pegged at 690. Because of the 17,000, 15,965 or 91.5 have recovered. 91.5%. Deaths pegged at 793, but as I said, it is only here in Cebu that we are verifying we go to each and every death certificate and check whether or not this person really died purely of COVID or whether COVID was incidental to the death. There's a difference, you know. So of the 793 actual COVID cases, 196. What is the percentage of that? 1.1%. Incidental findings are 565, and these are other causes. No diagnosis yet, there are 32 cases. Of the 690 active cases, those that are in isolation are 519, or 75.2%. Mild asymptomatics, 62.8%. Mild symptomatic, 62.8%, or 326. Asymptomatics, 193, or 37.2%. How many are hospitalized? 173, of which 93 are mild, or 53.8%, 41 are moderate, or 23.7%, severe are 4, 2.3%. What is others? Then why did we include that? So see, this skews the data. I'm only talking of COVID. So why are we including these other 35 na that are, so how can we put that this, at any rate, we should just have limited it to the COVID cases. Why did we, so atong gi-appeal ang 173 sa 690, kanang 173, ang 35 ani para for surgery, atong gi-COVID? At any rate, that is the situation in Cebu. At 690 active cases, 35 are actually admitted for other causes, but since it has become the regular or the standard operating procedure to swab them, they were swab positive. So that's 35 on a weekly basis, because you know, let us have a sense of scale. No? There is a claim here by Dr. Bergere that they have confirmed it. They are seeing double-digit 2-week growth rates in coronavirus disease based on DOH case bulletins. On face value, that is so alarming, double-digit. But what figures are we talking about? If we were to compare it, like for example, a place that has, shall we say, COVID cases of 2, and then the following day there are 2 more, so that's double digit. Is that? It's an increase of practically 100%. So let's have a sense of scale and proportion. Okay, it's quite alarming, double digit. Again, special mention, of course, Cebu province, because I know that, well, since we seem to be getting it right here, all eyes are on us. It did not help, of course, that there was this unfortunate pronouncement from the epidemiology department, which was latched on by media, which upon closer analysis, actually, there was no such statement of a third wave. But then, of course, for headline grabbing purposes, you had to put it, third wave in Region 7. And then the following day, to just make an about turn and say, but our critical utilization rate is low. You know, that could have all been contained in one story, but that had to be divided into 2 because you needed 2 headlines. Okay, let's look at the total COVID cases landscape in Cebu province. From April 26 last year, you can see that it gradually increased, peaked at 499, went down to 465, went up to 470, and then decreased. It went up again in September last year to 314, and then it gradually decreased, increased to 180, down to the lowest from December 27 to in the week of December 20 to 26. And then there was a gradual increase. We peaked in the total weekly cases at 735. That was in the February 28 to March 6th. Where are we now? We're at 456. You see, that is the nature of this disease. It goes up and it goes down. Are we now to sound alarm bells and churn out headline after headline every time the numbers go up? I have been often repeating this, and I just hope that this will be absorbed by people who seem to be so fixated in reading numbers. It is not about the numbers that increase in testing positive, because you see there are so many false positives. It is about being able to manage COVID-19. I've always said we can never hope to achieve zero COVID, but what we will always aspire for is to manage COVID-19, to contain it, to have a clear referral system, and that our hospitals will have enough hospital beds for COVID-19 care utilization, including critical care. So in this graph, you can see how the cases increased, decreased, and yet in the February 28 to March 6th period this year, were our hospitals overwhelmed? No. Were our isolation centers overwhelmed? No. At around that time, our hospital utilization was at 20%. Isolation was at 5%. Because why? Most of those that are asymptomatic are just either on home quarantine in isolation centers, and those with mild symptoms are able to treat themselves. After having learned from this disease for over a year, it's been a year now. We cannot keep on going back to the time when we knew nothing of this disease. So that is the graph. How does the picture look like in the number of active cases? Let's take up the active cases, because this is what is being reported by Dr. Bergeri, that suddenly there's a double-digit increase. These are the active cases now. In the April 26 to 31st, starting from April 26 to 31st, we peaked at 1,530. And that was in the January 15 to 20 period last year. Then from 1,530 active cases, we gradually decreased and hit the lowest at 505. From 505, we went up again to 569, decreased, went down to 240 plus, went up to 350. So you see, it's always a roller coaster ride. Cases increase and then decrease. They increase and decrease. But when we hit 1,530 last year, were our hospitals overwhelmed? In the province, I'm not talking of the city of Cebu. In the province, the answer is no. And when we hit the highest number in 2021 at 1,290, again in that same period, March 7 to March 13, at 1,290. Were we overwhelmed? No. Were our isolation centers and hospitals overwhelmed? No. Why? Because here in Cebu, we have established a clear referral system. We have established clear containment measures, and we know how to deal with this. We know how to manage COVID-19. So from that period, March 7 to March 13, February 26 to March 8, which we peaked at 1,250, we gradually decreased and hit the lowest at 353 active cases. Now we're going up. What's our total number of active cases? It's 695. Shall we start ringing alarm bells and hitting panic buttons? well, that makes for great inflammatory headlines. But if we are to be responsible at all, it is all about going back to what we have learned all this year, and how to manage COVID-19. We will tell you later. We will show you the actual occupancy in our hospital beds as well as isolation centers. But here is another graph which shows active cases from April 31st to December 31st. This is on a bigger scale, so it's the same thing. So is the next. Well, you might have wondered what are the causes of death. They should have been next to the first presentation. I said COVID is 196, but the rest are community-acquired pneumonia, 197, heart problems, 100, kidney diseases, 63, so on and so forth. But these were pegged. If I recall, dunay namatay diri motor vehicle accident, gibutang lang gyapon COVID. What are the other diseases in the province of Cebu? There's hypertension. There's tuberculosis from January 20 to July 11, 2021. And then there's dengue. Mortality per ratio. Well, the mortality of hypertension stands at 36 per 100,000. COVID is 6, tuberculosis is 6, dengue is 1. Have you ever wondered why our hypertension cases are rising? What happens if you're just cooped up in your house without any exercise at all? You cannot even breathe clean air. And you keep on thinking about the dread and fear that media continues to peddle insofar as COVID-19 is concerned. Other diseases will, of course, proliferate. Here's a graph of dengue, just to give you an example. Lo and behold, it does go up, it goes down. Goes up and goes down. It goes up and goes down. It's still another roller coaster ride. Isn't that the nature of the disease? And yet, do we even talk of dengue now? No, we don't. No one ever remembers dengue anymore. Do we even remember the dengue-vaxia thing and the vaccination of dengue-vaxia? Nobody talks about it. It's always about COVID, which by DOH bulletin has a 1.76% mortality. This is in the Philippines. You have dengue in Cebu province. This is even a worse roller coaster ride. It goes up, it goes down, it goes up, goes down, goes up, goes down. Nagkatag man ni, uy, nag-ambak-ambak man ta. This should have followed after the first presentation. Now, our COVID-19 hospital bed occupancy. That we have used. Because as I said, we have to be careful about whether or not our hospitals can accommodate not the mild cases, because if you start sneezing and you start coughing and you believe you have COVID, you rush to the hospital, then necessarily you will be overwhelming our hospital system. That's why we have a clear referral system here, that from our rural health units to our district hospitals, to our provincial hospitals, before they are even referred to Vicente Soto, we already graph the gradual need to go to Vicente Soto or our COVID level 3 na hospital. Why? Because you have to weed out those that are asymptomatic as well as mild. We didn't know that before. Those first few months, everybody rushed to the hospital at the first sign of a cough or even a slight fever. That overwhelmed the entire hospital system. Now we know better. So, In the province of Cebu, we have 400 beds set aside. Remember, we have 4 provincial hospitals and 12 district hospitals. 400 beds have been set aside. What is the actual occupancy? There are 39 COVID cases, occupying 9.75% of our 400 beds. In the LGU isolation centers, you've probably heard this before, let me repeat this. Just for the enlightenment of those that keep on ringing alarm bells and wishing ill of Cebu. Our total isolation beds are 2,464, with 84 COVID, with 84 in isolation, tested positive. That is equivalent to 3% occupied, leaving 97% of the 2,464 open. Per DOH data, in the entire Cebu Island, we got this from the DOH page itself. There's a total of 1,591 beds available for COVID. Occupancy is now at 624. That is equivalent to 39.2%. 39.2%. Well below the danger zone of possible overwhelming of the hospital system. Bohol, in Bohol, they only have 363 beds. Naturally, with 240 occupied, that pushes up to 66.1%. So you see, we have 624 COVID cases. But since we have 1,591 beds available, the occupancy is much lower at 39.2%. In the province of Bohol, this is the OH data, with only 363 beds available for COVID, and with 240 cases, that pushes up the occupancy to 66.1%. What's my point? It's about having enough COVID beds. It's about hospital system. Because if we increase this number of beds available for COVID to even just double, then necessarily the 66.1% would drop. That is so simple. I am sure that even those that have been ringing alarm bells would understand. The same goes for Negros Oriental. They have only 302 beds available. Occupied is 133, well below our 600 plus in Cebu. But that pushes up the occupancy to 44%. So it's so simple. The more beds, the lower the occupancy, regardless, even if there should be an increase or a spike. It is about hospital management and COVID management. Siquijor, well, let's not talk about Siquijor. Well, yeah, let us talk. They have 66 beds available, 18 are occupied. That's 27.3%.